Well, let's go into the presentation. Research funded by the Modern Slavery and Human Rights PAC, carried out by the Manchester Metropolitan University in collaboration with the NWG Network, found that children with special education needs and disabilities are at high risk of criminal and sexual exploitation. It found that children with SEND are being failed as opportunities to protect them from being groomed and exploited are being missed by services meant to protect them because of the lack of funding, because of little recognition of the vulnerability and of the strategic approach to prevent it. Then the second piece of research pointed to new approaches that foster a culture of open conversations with children and young people to improve the response and identify risk of exploitation before it happens. So in this lunchtime seminar, two researchers from both of these projects will talk you through about the findings of the research and the ways we can improve the response to protect children and young people with special needs and disabilities from grooming exploitation. So we've got two people who will talk us through it. We've got Professor Anita Franklin, who is a professor of childhood studies and faculty lead for health and education in the Institute for Children's Future at the Manchester Metropolitan University. And we also have Dr. Sara Goff, apologies for that, with us, who is a teaching fellow at the Department of Government from the Manchester Metropolitan University as well, who also worked very closely on this research. And I think it's time for you to take us through the findings of the research. The floor is yours.
Anita, do you want to introduce yourself quickly?
I think let's go for it, because I think Jakob was fine. He introduced me. I'm quite happy.
Right.
So thank you. Go for it, Sarah.
Can I just say, Jakob, thanks, but I'm not a doctor. So I'm a children's social worker by background. I'm now an associate researcher.
You should take it anyway, I think.
Yeah, one day, hopefully. Right. Thank you very much, everybody, for your interest in the needs of these children and families. As Jakob's kindly explained, we're going to talk about these two studies. We've put pictures of them on the first slide. And if I could have the next slide, please, Izzy. The first study, the internal trafficking, I'll talk about for a little while, and then Anita will talk about the second study, which is the early conversation study. We've put the link on the slides for you here, which will be shared as I understand it, Jakob. May I have the next slide, please, Izzy? This is the second study, the opening conversation study, again with the link, so that you can locate that on both the MMU website and on the Modern Slavery PEC website. So I'm going to take you through some of the findings and learning from the first study. So without further ado, next slide. The aims and objectives for this study were really clear and key. What we wanted to do was to begin by having a close look within relevant law, policy and guidance at the extent to which current law, policy and guidance about safeguarding and about modern slavery actually refers and specifically addresses the needs of this group. We wanted to examine practice responses from the perspective of practitioners, but we also wanted to examine practice responses from the perspectives of parents and carers. And thirdly, we wanted to talk and consult with frontline practitioners to better understand what they thought of as the barriers. And lastly, we wanted to develop practice and policy recommendations. So that was the four key aims and objectives of the study. Next slide, please. So what did we actually do? What does this mean that we did? Methodology is about the ways in which we sought to get the questions answered. And the first thing that we did was that we did a detailed trawl of all the key bits of legislation. So for example, the modern slavery guidance, working together, the SEND code of practice, and sexual exploitation guidance. And then we carried out those 4 stages of research work, and we spoke to 12 parents. These were parents of children with special educational needs, and for the most part, these were children who had autism and were neurodiverse or had attention ADHD. It's not a phrase that we like, but ADHD. And the age range of the children was from 9, so that's very young, 9 through to 16. So we spoke directly to 12 parents, and our focus groups and online consultations took us into contact with 40 practitioners, and they were from a broad range of disciplines, from social work, police, youth justice, from youth and education, health, and other services. We made, thank you, may I have the next slide? And the work that we've done, and we're summarising it very, very briefly for you. We hope you'll look directly yourselves at the reports in more detail, because there's an awful lot in there. But just some of the key top line findings. The first one, perhaps, that's really significant in terms of how a child or a parent experiences being helped by services, was that practitioners responding had real gaps in the way that they understood both modern slavery and the whole context of exploitation, and secondly, how to respond to children with special educational needs and disabilities. There were very mixed perceptions and understandings of what learning disability is, what that actually means, not just in terms of how a child understands the world, but the significance of having disabilities in terms of how a child has been treated, responded to, and the fact that this group of children across the board have higher risks of harm and abuse, and so are more likely to have hidden trauma and hidden impacts of previous harms. There were significant challenges in terms of what people saw as being a disability. And for some local authorities, neurodiversity and autism were not counted, and that meant that people didn't switch on to thinking about the ways to adapt practice and change practice. And one practitioner said, actually, you're either seen as a child with a disability or a child that's being exploited. What we're not doing is bringing together these 2 worlds in terms of how we respond. And this has significant impact on both identification and also response and putting the right services in place. And the other really critical key finding was that across the board, little specific training to help practitioners look at both modern slavery and disability combined. So we're recommending strongly that that should be addressed. Next slide, please. The work that we did, both talking to practitioners, significantly talking to parents, and very much looking at the policy guidance, highlighted that there is a really clear pathway. Families not getting the services that they need, and undiagnosed, unrecognised disabilities, with families not receiving the right support for children making a transition, and children being excluded from school. The lack of getting the right help as a disabled child, as a child with special educational needs, creates a clear pathway to exploitation. And very specifically, and you'll all be aware, I'm sure, of practice gaps in your own localities, but there are very significant waiting lists. So lack of specialist services for diagnosis. We've heard of waits between 1 year and 4 years, real major gaps waiting for special educational needs assessments, waiting for speech and language therapy, schools not having enough TAs and staff to support teachers in class and SENCOs, school nurses far, far less time than they used to, lack of education welfare services in a lot of spaces to pick up and explore, and social workers just simply not having the time. The problem is that this leaves a gap. Perpetrators very, very good at sniffing out vulnerability and nipping into that gap. Next slide, please. Key messages, both from practitioners and parents, describing continually and frequently, it was shocking the number of times we heard this, patterns of description of children with special educational needs as naughty, learning disabled and neurodiverse young people described as challenging, a focus on the individual as the problem rather than seeing the broader context of what is happening to children, a really, really damaging sense in which the young person was seen as the problem rather than tackling the risks to them. And seeing the young person as the problem often leads to that young person themselves being isolated or subject to school disciplinary and other procedures. School breakdown was a massive, massive issue, and I don't think we can underline the extent to which both social workers and parents described breakdown in education placements and the links and how powerful and important it was to work to keep children in school. Next slide, please. Parents, critical messages for us, and I think very, very uniform. And for the parents among us today, I think listening to their experiences about the extent to which they had not felt heard when asking for support when their child was young, going through early childhood, middle childhood, not getting the right support, and then secondly, parents again not being listened to when they were beginning to recognise that their child was at risk of exploitation, both on and offline. So not being listened to, both for the SEND need, then for the risks years later. What we're having then is a pattern of years of a family not being listened to, and then when they were finally heard, very disturbingly, parents seen as the focus of concern, and support and the right help not being given. So presumption that the concerns were based around the home rather than what was happening outside. And for parents, the exhausting, draining and unjust issue of being seen as a problem rather than listened to when they ask for help for their child. Next slide, please. The policy gaps were deeply troubling. There's a cursory nod in working together. There's a cursory nod in modern slavery guidance, in sexual exploitation guidance. What none of the big pieces of guidance do is offer a how. What should practitioners be doing differently? How do we adjust? What reasonable adjustments should be made? And so, for example, this really impacts the way missing interviews are carried out, the type of preparation that's done, the work that's done to think about how to talk to this particular child, leading to ineffective, for example, return interviews, and a lack of joined up working. So when you've got the return interview practitioners not talking directly to schools to find out the best way to communicate with this child, or not talking directly to parents to find that out. So missed opportunities that would have facilitated better conversations. Next slide, please. And last point from me, some key recommendations. So colleagues will read these, and parents are more than welcome to read these in the reports. We hope that you will go to those reports, and please get in touch with us. But key things that we would like to see is some up-to-date specific guidance from the DfE on the safeguarding of these children, some very specific work by local safeguarding partnerships to identify champions, some meaningful data collection, and not just gathering data on how many of our children with SEND are experiencing such risks, but also where are they in our systems? How early are we responding? What can we do? We want to see across the board robust and much more strong and for everybody training to look at the combination of these two areas so that we can address risks earlier and work better in partnership with parents. This whole journey needs to be informed by what parents have told us, some very clear, powerful messages from parents, and they need to be at the forefront of practitioner thinking. Anita, over to you.
Thanks, Sarah. I know that's a bit of a quick whistle-stop tour of actually what's quite nuanced And yeah, as you said, it's worth reading the report, I think, because there's detail in there. We could have picked any policy, we could have picked any guidance, could have picked any law actually and highlighted the gaps. We chose missing as just an example. So I think that's really important to stress. I think as well what we didn't have time to, and because you were so quick and succinct, I will say it now, is just to acknowledge the support that we had across the board actually in undertaking that study, because we weren't short of practitioners, we weren't short of parents or you know, wanting and willing and pushing us to do this study. And I think that goes to show the level of kind of concern that this group of children's needs aren't being met. So I just wanted
that's
to
right, Anita. And it was practitioners themselves pushing for training, wasn't it?
Yeah.
It was practitioners saying, you know, we're noticing very high numbers of these children in our services. We need the right help and support.
Absolutely. There was consistent messages across that whole study who we talked to be fair. So I have to quickly move on to the next study. And I will bring things together at the end, but I know we're sort of quite short of time. So as Sarah said, we were looking particularly at law, policy and guidance in terms of identification and responses. However, in that study, we did highlight how prevention also didn't feature in many of these guidance and policy. And then the Modern Slavery PEC put out a call around prevention studies. And we thought, hang on a minute, we need to do something around prevention too. So we went back to the young people that had helped us with our recommendations for the first study. We thought long and hard about what we needed to do around prevention for this group of children. So we went to the young people and said, okay, you know, we've got an opportunity for funding for prevention. What do we need to do? Do we need resources? Do we need videos? Do we need something that raises awareness about modern slavery? And they were very clear. They said to us to the effect, Anita, you're talking rubbish. What we need to do is really go far upstream from that, not quite the words they use, far upstream from that, in terms of actually preventing the vulnerability that may create opportunities for exploitation. Because if we do one-off lessons, that's great, and of course we need to know about this stuff, but actually that's what it is. It doesn't necessarily translate to situations that young people may find themselves in. So we had that. We also had research and background research from what we'd already done back in 2018 that looked at risk assessment toolkits and how practitioners were identifying risk in young people. And what we found back in 2018 was that indicators of risk and these toolkits that were being used were actually indicators of actual harm. So they weren't necessarily preventative. Things have hopefully moved forward a little bit by now. But these toolkits were also very rarely acknowledged a child's disability. Some of them do now have a tick box, but there's nothing in many of them that actually goes further into actually understanding how risk may impact on how disability may impact on risk and vulnerability for a child. So we knew there was little adaptive practice or information that actually would support identification of risk. So we had those two things. We designed the study with the young people. So, sorry, Izzy, can I have the next one? What they wanted us to do was to think about how we could explore with practitioners how open, safe spaces could be developed for children and young people to talk about their lives and identify concerns at a very, very early stage, before maybe even exploitation is considered or thought about. So it's about creating these spaces. So we did workshops with a diverse group of young people. They were aged 16 to 23, and most of that was to do with ethics and time to be able to work in safe and accessible ways with this group of children, young people. So they had a range of neurodivergent needs, physical learning needs, or trauma. And we also undertook online focus groups with 28 multi-agency professionals as well. And this was about discussing the barriers and facilitators, having these sort of early conversations when quite clearly we could see in the first study, things started to go wrong for children. Can we get in at that point before exploitation, you know, to create that sort of safety net, I suppose. Thanks, Izzy. Move on. So we did these focus groups with young people. And very quickly, there was consistency across what they were saying, but also consistency across actually what practitioners were saying. And there's no surprises really. I think very quickly this framework emerged around what children and young people wanted. And they talk about faces, spaces and places. Now, anyone that does sort of good youth work or social work will recognise this as good relationship-based practice. But what the young people in this study were able to do was shed a light, I suppose, on what those things mean for children and young people with special educational needs and disabilities. So I'll whiz on to the next one, Izzy. So if we talk about trusted faces, so that's the qualities and the ways of being that the young people wanted from the people who work with them. So they talk about trust and confidentiality, and that's central. And that's probably central to any practitioner's work with a young person. What they were explaining and exploring was so much of that was dependent on the adult knowing the child and being interested in them, and not just seeing them through the lens of their disability. So a sort of quote was, I don't want to be the autistic child, was like, you know, I'm more than that. I'm more than just my label. So it was dependent on the adult knowing the child, being interested in them and not having previously let them down. So if we're expecting young people to seek out support or you know, when things start to go wrong with them, talk to adults in their lives, this kind of trust, knowing the child, not having been let down, particularly around their special educational need and disability. Many of them, as we've already said, hadn't had the support that they needed around this. They'd already felt let down by the professionals around them. And many talked of it, and we can use the term accumulated harms, layers of trauma. They felt very let down by the systems around them. The other thing they wanted in these trusted adults that could provide them with some sort of support was around understanding how they may present and communicate. And we've already explored how they can often be seen as challenging or the problem child or whatever it may be. So this trust has to be built on knowing the child, understanding disability, and how they may present and communicate, but not losing sight of the young person in that. So it's quite interesting. They talked about who a trusted person might be, and they were really clear that that person may not be the designated safeguarding lead, particularly within schools, and particularly because that designated safeguarding person may not have experience of special educational needs or disabilities or know them, and all of those things are important to them. So absolutely, that lack of support means trust can be damaged, and being available so that they're a known person. You shouldn't have to go to them and find them, they find you. So they wanted a proactive approach. So thanks, Izzy, always on. So spaces. The young people define space as time and situation. So space for non-pressured, open-ended time to talk. And that was important to them, as it can take them longer to communicate or for staff to understand their communication. But young people and practitioners we spoke to were very aware that pace and timetables of school prohibit this. Young people themselves said, you know, it's really difficult for teachers. They understood this. So they talked about when appropriate time of to have these kinds of conversations were. And again, end of day doesn't work for some because they may have been masking autism all day and they can be exhausted at the end of the day. Lunchtime might not work for a young person because it can be the only time that they get space to sort of relax. So they talked very much about it should be child-centered, when a child feels most comfortable. Knowing where to go for help was important, and knowing that they wouldn't be questioned by other staff was important. So there are a number of examples they talked about where they had to go to reception and ask to speak to the safeguarding lead, and the receptionist will say, what do you want to see them for? And this was in an open space. So it's really sort of thinking critically about how these things are set up so that we can make it more comfortable. Young people also talked about opening spaces for different ways to communicate. So not that face-to-face, you need to go to the safeguarding room kind of thing, but different ways that they could communicate if they were worried about anything. And then the final bit is, sorry, Izzy, was on safe places. So again, this is around the physical environment. So quite often we think about the physical as being sort of accessible in terms of being able to get to somewhere. But for them, the physical environment was around the sensory, very often the sensory, the bright lights, the smells, outside noise, and obviously being visible to other pupils was a real issue. Now I focused very much on schools, and I think it's important to note that we didn't place that focus on education in schools. We actually went very openly to young people about the place or about where people may be, staff may be, where these conversations could be had. And actually it was them that placed the focus on education, and it was because they saw that this was the place where conversations would most likely happen, because the majority of disabled children aren't accessing community services or activities. It's often the first thing they stop doing when they're struggling. And interestingly, it's a place for fun, a downtime. So they didn't want to use this space to open up these kinds of conversations. I think that's important to note. And then I'll quickly, I think I've got a couple of minutes. So some concluding comments across both of these, across this study first. Professionals often identified the same barriers that the young people were, that could prevent these creations of quality interactions. Again, lack of training and awareness of SEND and exploitation hampered this kind of preventative work. But what we've tried to do with the young people, with practitioners, is identify a culture of conversations in settings. So sort of offering an environment where risk and vulnerability could be identified and discussed. Okay, so next couple of slides. Thank you. So what we want to do is just quickly draw attention across both of these studies, because what we found across both of them is that there's been an inadequate attention to the needs of this group of children, young people. We've talked repeatedly about a lack of robust training. It's absolutely critical that we talk about a lack of data collection and a lack of understanding of this group of children, because if people aren't recording or noting that a child has a special educational needs, we know nothing about the extent of this problem. And what we were identifying from practitioners was, you know, anything up to 80% of their caseloads of practitioners working in exploitation was saying these children had special educational needs. So there's something there about good, robust data collection on this. And then the last one, thanks, Izzy. We found repeatedly missed opportunities for early intervention and response. Engagement with education services, we've already highlighted, is one of the most important factors. And also practitioners and parents were really clear that being in school was a significant factor in keeping these children safe, but it had to be in a school, as we've heard from the young people, that actually meets their needs. Responding well and responding early requires parents, parents' concerns being listened to and relationships being built. Thanks, Izzy. We'll go to the next one. And particularly from the young people, you can see that we really need to consider this impact of trauma and this complex layering of SEND and exploitation, because many of the children, young people and their parents talked about having experienced unmet needs and trauma associated with not having their SEND needs met, and then exploitation on top. So it was like, you know, they've been fighting systems for many, many years to try and get support for their children, young people. And I think as a final point, just to conclude, young people with SEND may communicate in different ways, but we feel that absolutely they should be listened to, heard and believed, however they may be communicating these things. And I think the last slide is just to say thank you for listening, and please contact us for any more information. And I think we've better move on to questions, if that's okay.
Thank you so much, both, for presenting the findings from both studies. We went a little bit over time, but since it was 2 studies, not 1, I think we can forgive that on this occasion. But let's move on to the questions. Just a reminder that you can pose your questions in the chat, or just raise your virtual hand and we'll bring you on the screen and you can ask it this way. So feel free to start that. I'm going to start, if that's okay. I think what struck me the most is here is the kind of divorced world of two worlds completely, and one, the world of disabilities and special needs, and the second world of exploitation. What also struck me from both studies is the enormous complexity of the world and services that children and parents come in or may or should come in contact with that should be able to help. So the first question is, where do we start? Actually, that was when I was jotting down the questions, my first question is like, where do we start to improve protection of children? How do we bring this world together?
That's such a
I've got something to say. Shall I start, Sarah?
Yeah, sure.
Yeah, I think there are opportunities. So I think if we start, Sarah has come from practice, so I'm sure she'll say some practice things. If I come from policy, so I'll start with policy. So for me, I think there are opportunities. So just last week, the government announced that they were going to implement all the findings from the ICSA report, so the Independent Child Sexual Abuse Inquiry on grooming gangs. And many of the findings within that specific report have very significant impacts for children, for disabled children or children with special educational needs and policy. So when we have an opportunity to change policy, let's put or have some lens on this group of children and young people. So I'll give a very specific example. There was a commitment to updating the CSE, the Child Sexual Exploitation Guidance. At the moment, there's little reference in there to children and young people with SEND. That gives us an opportunity to put in there some very direct focus on this group, but direct opportunities for how we deliver practice. So I think there are opportunities to break down what might be seen as complex, and it doesn't need to be. So I think that can be very something that could be done alongside renewed guidance, working together guidance, which is specifically focused on safeguarding disabled children and young people. So there's ways that we can bring the two worlds together. I don't know if you want to say anything, Sarah, from a practice perspective.
Yeah, I chair the National Working Group on Safeguarding Disabled Children. We've been calling for years for up-to-date Safeguarding Disabled Children guidance. The last one was 2009. So I think a massive priority is for the DfE at government level to recognise this group and their additional vulnerabilities, as Anita says. Disabled children are part of children as a whole. They are an intersectional group. They are Black disabled children. They are gay disabled children. They are children from a whole range of backgrounds, urban, rural. There are massive issues with poverty. There are big issues with parents with learning disabilities. So we need the DfE to take this on and look at policy level. But I think the other critical thing that we need, and today many of us are probably from services, from practice, and we're here because we care. And I think a critical thing for us to do is to take these studies and other research that's relevant, but take these studies into our team meetings, go through the recommendations in team meetings, and take the recommendations to our local safeguarding partnerships and ask our local safeguarding partnerships to have somebody appointed with a lead and to set out ways in which they're going to open up dialogue with parents. There will be parents of disabled children organisations in every local authority. What we need is concrete steps. Start talking to parents, service leaders, start reflecting on what does it mean to train our staff, what does it mean to gather data, and local safeguarding partnerships to start thinking, how can we have a champion? We've got the disco role. How can we make sure that within our local safeguarding partnership, we have a standing agenda item on the safeguarding of learning disabled and children with SEND? And how do we specifically make sure that our exploitation teams are starting to think, how can we allow some extra time? What training do our staff need? How can we improve our assessments? So I think there's really concrete steps at national, at leadership, and at frontline practice levels. There is stuff every single one of us can do. And the massive issue that these children are telling us is, we need your time, we need your attention. Please think about us.
Quite a lot to do to start with. I think there is a question of funding which I wanted to ask, but maybe we can park that for now and give the floor to some of the participants. I enabled Gurjit to turn your mic on if you wanted to ask your question, please.
Yes, can you hear me?
Yes.
Yeah,
Yes,
great.
we can.
I applaud what you're trying to do, but I'm just wondering, there seems to be a stumbling block because neurodiversity is a framework for understanding human brain functioning, and mental illness are very different. Diversity is a human condition and cognition that's to be expected and normal, but people who are neurodivergent may not meet the threshold of a disability. And I've had this, for example, with a young person who, under the Equality Act, because she's disabled, because she has epilepsy, didn't actually meet the criteria under the Children's Act. And I think that's, unless we change the definition of what under the Children's Act is what a disabled person is, I think we may struggle. But I'd welcome your thoughts.
I don't know what Anita thinks on this one, but this is a very, very relevant point, Gurjit, that we're dealing with right now in responding to the Law Commission. Some of you might be aware that there's a Law Commission looking at the question of revising legislation around children with SEND and access to services. And one of the key critical points is this very issue of how broad is the definition, and how the existing definitions and chronically sick and disabled and the Children Act are out of date, use out of date terminology, and need to be addressed. So yes, I think we're totally on board with what you're saying, and very much part of pushing for that definition to be broadened. And I think the critical issue for us, and if you look at the World Health Organization definition or the Equality Act definition, they both ask us to look at a social model thinking of disability that looks at what the barriers and economic challenges are for those young people in achieving their growth and development and well-being. So I think, yeah, absolutely spot on. If we had 2 hours, Gurjit, we could pick this apart and come up with a whole new wording, couldn't we, Anita? But we've done a lot of work around these issues, Anita, haven't we? And you particularly with some of your work.
Yeah, I think it's really challenging. Many of these young people were waiting diagnosis or assessment. So actually, you know, that it's very, very hard to kind of come up with a way to describe this group of children, because, you know, they are, we tend to put them in boxes, you know, according to a diagnosis. But actually, many of these children, we just need them to see, you know, what's in front of us, how they're presenting, how they're communicating, and adapt the way in which we work with them. So I think sometimes, you know, you have to work around things to keep the child at the centre, and I think that's very challenging when services are so strict on criteria. But
and I think we have to challenge the belief that you've got to wait for a diagnosis before you offer any help. We've got to absolutely challenge that. These families and children need help when they're telling us they're struggling. We need to listen.
Thank you both. Shall we go to Ewan, who raised their hand next? Please, you can unmute yourself and ask a question.
Great. Thanks a bunch for putting together this research and the webinar. I really appreciate it. I suppose it'd be useful to give some context first before I do my question. So I used to work in supporting SEN students, especially in education. So I saw things that I thought were a bit suspicious and concerning, but then now that I've moved into doing modern slavery work with schools and public sector in the UK, everything is starting to make sense, and I can see why they're more vulnerable to modern slavery. And for me, I primarily work with schools now to support their sustainability and their modern slavery policies, supply chain due diligence, as well as just general governance around the issue. And I suppose the thing I want to ask is, from a practice perspective, what are the most effective things that schools can do to protect SEN students from vulnerability to modern slavery? Is that training? Is that certain policies, certain best practices? I'd be curious to hear from your perspective what that would be.
Okay.
Go, Sarah. Go on.
Go, or do you want to go? Nico?
I mean, we could see very distinctly in the data that when things started to go wrong, but parents were telling their experiences of what would happen. And we've also heard it from young people, not just in this study. We have done work in 2015 talking to young people who had experienced. At that time, we talked about it in terms of not just, but we were talking about it in terms of sexual exploitation. We're now talking about criminal exploitation as well, and it's a much wider lens that we're putting on things. What the young people say is the same sort of thing. It's about within schools, it's about having their needs met. It's about feeling part of a community, being able to feel that they belong to the school. They talk about having people who understand them and who they can go to. So if we want to talk about prevention, they want to be in places that keep them safe. And I think from the other side of it, it was very clear from practitioners that actually if we don't put a lens on why children are being excluded from school and the difficulties and challenges around exclusion, off-rolling, that actually make young people not want to be in a school environment, it means that actually they're then out in the community and when we know they're being particularly targeted. So there is something there about schools. And it's a wider thing, isn't it? It's around, quite often changing cultures of schools, which I think is a very challenging thing. But it was very clear from the data from what parents saying that we need to change cultures, and we need to think about sometimes when children are excluded, we need to look behind. We need to look at the reasons for some of that. And some of it may be about putting a lens or thinking about exploitation could be all part of what's going on. Do you want to add anything more to that, Sarah? Or?
Yeah, I think there's some really concrete, specific steps. And Ewan, it's amazing to hear your journey because you've looked at the same kind of overlaps as we're looking at. So perhaps we can be in touch. It would be great to be able to be in touch with you following today. But critical issues, I think the first one is for all of us to reflect on our culture and the language we use around children, and stop seeing children as a problem. So tackling culture and really unpicking what it means to understand that children with special educational needs, children with learning disabilities, neurodiverse children are often seen and described in negative terms. We need to listen earlier and pick up. These kids are often more isolated, less likely to tell anyone, less visible and less used to being heard. So preventatively, how can schools develop committees and platforms and groups where children with SEND get used to having their voices heard across the board, so that when there are problems, it's easier to start to talk to them? How do our school councils work? How do we get these kids to have a space in school where they're respected and valued and heard? What can we concretely do to prevent school exclusion? There is an awful lot of blips and incidents and problems on the way to a kid being out of school, home educated, or even excluded. But once they're out of school, home educated, or excluded, it is much harder for safeguarding practitioners to pick them up, to support parents, and to listen to the child, because they've become less visible once they're at home all the time. How do we prevent school breakdown and work together with multi-agency teams? The next critical thing that we can do is examine the content of our relationship and sex ed. Kids are not responsible for protecting themselves, we are, but to what extent are we making sure that our RSE is adapted to children with learning and communication needs concretely? What can we do to run parents' workshops? And what can we do to tackle bullying? Because if we've got groups in schools that are bullying and that are further isolating these children, and they haven't got strong friendships and positive networks, then it's much easier for perpetrators to pick them up because they're isolated and they want to fit in, they want friends. So there's tons that we can do. The question is, do we make the time and give it a priority?
Yeah, that makes a lot of sense. Thanks a bunch. The prevention part makes a lot of sense because the student that I worked with in the past, he probably spent about maybe 18 hours a day on his computer playing games, and because he had no friends in real life, a lot of the conversations that he told me about with people online were really deeply concerning. And at this point, he was isolated already. So the prevention piece really makes sense. So thanks a bunch. And yeah, let's definitely get in touch as well.
Thank you, and thanks both for responding. Goff, I can see that you raise your hand, but I just wanted to ask some questions from the chats in the meantime, so I'll move on to you next. There were a couple of questions about the data collection, including about Anita, you mentioned that the anecdotal evidence that there is a really high percentage of children and young people who are identified as people who are exploited in modern slavery, as having special needs or disabilities. So if you could clarify what the stats suggest.
Yeah.
There was also a question: what does it mean for practitioners working with survivors of exploitation, and also what can practitioners do to improve that data collection? Sorry, quite a few questions in one.
That's all right. So in terms of, sorry, I've probably whizzed through this rather quickly. So the challenge we have is that very often data that's collected at both a local and national level doesn't include data on disability. So it's not disaggregated. So it's very difficult for us to be able to talk about prevalence rates. So even within like the national referral mechanism, where children obviously who have been trafficked should be referred, that doesn't actually have an option to record disability. So it's very hard for us to be able to put some sort of definitive answer on the numbers of children who have special educational needs and disabilities who are being exploited. Some local authorities do collect this, many don't. And as you've seen with I said about the risk assessment tool, sometimes there's not even a box to be able to record this. So it's very hard for us to have definitive numbers. What we did do within the first study was when we talked to the practitioners, we asked them about their individual caseloads. And that's where we can, you know, we don't know if that's representative across the whole of the country or not. But what practitioners were saying to us that when they were working in this space, between 50 to 80% of their caseloads were children who had special educational needs and disabilities, predominantly neurodivergent, and by that we mean autistic, ADHD, and or learning disabilities. So it's very difficult for us to know if that's representative, but it was strong enough across the practitioners we spoke to feel that it needed to be in the report that we wrote with the caveat. So I hope that clarifies the point. And I can't remember the second question. It was around how it can be recorded. Is that right? Did you write that one down, Sarah?
How should we improve that, really?
Yeah, how can we improve it? And I think these are such great questions, all of them. One of the key things that I think we've noticed from serious case reviews and from other work that we've done is that occasionally, take care of people that are leaving. Thank you for coming. One of the things that we've noticed is that in case reviews, it's often been recorded that a young person who was exploited had ADHD or was autistic, but nothing is recorded about what that meant for how that child thought, responded, had been treated, preferred to communicate, whether they like to work with drawings, whether they like to work with signs, with PECs, what was the best way, the best place, what their sensory needs were. And I think one of the very first things us as practitioners can begin to do is ask young people, what does it mean to you having ADHD? How do you prefer to communicate? What can we record about how you prefer to work, so that we can actually start to build up a better picture of what children need? If we're talking about making reasonable adjustments under the Equality Act, our practitioners need to be allowed longer time, training and resources to work in different ways. A lot of neurodiverse and autistic children struggle with various sensory issues. So we need to record the type of environment they're most comfortable to work in. And then maybe we need to be creating those rooms and spaces. Anita talked about spaces and places and faces. Concretely, how we make those spaces available depends on having enough data about the need for them to convince managers to invest in the right kind of facilities to work well with these children. So it's about not just putting it in a box that the child's got ADHD, but it's about doing something about what that means. Does that help? I think we've got one more question.
Yeah, I think so. Yeah, thank you so much. We kind of running slightly short on time to fit within an hour. So, Kath, if I can go to yourself, I think you can unmute yourself, and I think that's all we're going to have time for today.
Thank you so much. Sarah, Anita, thank you so much. I'm sorry I can't unmute because I can't put my camera on because my IT is buffering. I had two questions, so I can either email you separately or can quickly try and rattle through. One of my questions was, how could GPs... Sorry?
Do both.
Oh, thank you so much. One of my questions is, how could GPs in primary care be more impactful? And my second question really was, have you found that conferences like Risk Outside the Home, Harm Outside the Home, have you found those conferences have made a difference in changing mindset of practitioners?
I think we'd like to see more conferences, more research, and more time focused on the needs of these children, Kath. There's very, very little research.
Absolutely.
Very, very difficult to get funding. We're so grateful to the PEC and Jakob and Izzy and colleagues, but we are so short of research on what works. And we absolutely want to be running sessions with GPs in primary care to look concretely at their working days and where are the points we could input and develop practice along some of the lines we've just mentioned. I'm sure we'd be happy to have a separate discussion about these questions with you. But Anita, what are your thoughts?
I think that's fine as an answer. I think getting access to GPs and then finding the time to be able to engage in this, I think is very challenging. So I think we would love to talk to any that want to be involved. But absolutely, it's critical, particularly as that can often be the first port of call for families when they're needing support. So actually having an awareness and being involved at that very early stage, I think could be really critical in terms of prevention and response for this group. So absolutely, it was a good question. Thank you.
Yeah. I will email you both afterwards if that's okay, because I work with a lot of GPs and do a lot of exploitation training with them, so we'll perhaps link in.
Fabulous.
Yes,
thank you.
Please do.
Thank you so much, both, for answering all the questions. I wish we had more time to discuss, but we've run over time, and I don't want to take people's time off their lunchtime anymore. But please feel free type into the chat. We'll try to get the unanswered questions to Anita and Sara, and let's see what their capacity is to answer the questions. Let's try to continue the conversation. But thanks everyone to everyone who asked the questions. Thanks everyone for joining in. My colleague Izzy just posted a link to a very short survey. If you could spare literally 2 minutes to fill that out and help us improve it. Especially we're interested in how the having people on the screen look like. We're still kind of learning and always in the learning mode. So please tell us how we can improve those. Thank you so much, everyone. You can also sign up to our Google group where you can ask questions and take and start these conversations that we can continue beyond the webinar. Obviously, sign up to our newsletter to find out about all future events. But for now, thank you so much for taking part, and thank you, Anita and Sara, for sharing your expertise and knowledge. Thank you.